this is another community conversation. Sharing the screen with me is Alan Dienstag. Hi, Alan.
Hi, Mike.
And you're the clinical director of the Larchmont Mamaroneck Community Counseling Center. These days of COVID, what's to worry about? This is also Mental Health Month in May. So my first question, why do we need a month to talk about mental health?
It's a great question. The reason is that we still, despite all the progress that's been made, treat mental health and mental illness in a stigmatized way. And the example I like to give people is that, a very simple one, if you're not feeling well, you don't hesitate to call your employer or your office and say, I'm sick today, I can't come in, as long as it's a physical ailment.
Yeah.
But if you're having a psychological or emotional difficulty, imagine how hard it is to call and make the same kind of statement, right? We don't treat mental wellness and mental illness in the same way that we treat physical illness. We still stigmatize it. We make people feel ashamed about it. And so from a cultural standpoint, to have Mental Health Awareness Day is just one way to kind of bring out into the open the reality that our mental well-being and our mental illness is a part of our life in its totality, and something that we should always be thinking about, just like every aspect of our health.
Well, with your help, we're going to do that for the next several minutes, and I hope viewers will stay tuned because they're going to find out a lot, as I did in preparing for this interview. So I mentioned COVID, and of course that has not exactly freaked me out, but had been very concerning in the last year. How do I know how I'm doing? How do I know that I'm in good mental health?
Yeah. Well, I'll tell you, I think you mentioned freaking out, Mike, and I want to start right there. We at the counseling center, we talk about freaking out effectively. So in other words, we don't take freaking out off the table. And if you were freaking out about COVID, you were having all the right feelings. It's a valid reason to freak out. It's a valid reason to be afraid. At the outset of this, part of our message really was, to validate and to self-validate all of these feelings of fear, uncertainty, and sadness that we were all exposed to. It was quite an extraordinary and unprecedented sort of load on all of us emotionally. And so, that first piece is really important, and it's an important message to get out there, right? Which is that it's whatever feelings you're having about this, that's okay. Recognize them, label them. Labeling is a powerful psychological tool. It's as simple as it sounds. Say how you're feeling.
Right.
When you say how you're feeling, you activate brain areas which help you cope, right? So how do you know? You check in. You check in with yourself.
Check in with myself. Okay.
Yes. You check in with yourself. How am I doing?
I'll tell our viewers that you told me about a quiz that I could take, a 2-minute quiz about how I'm doing in comparison to the rest of the nation. And I think the rest of the nation was an average of 70, and my score was 74 out of 100 points.
Yes.
So what did that tell me? That I'm not in great shape, so to speak, psychologically.
No, you're doing pretty well, Mike. Listen, you're a little bit above average. You're a little bit above average. So this little test is something that I picked up from believe it or not, there is a project at Harvard called the Human Flourishing Program, and they study flourishing. And what is flourishing? Flourishing is the state of being in which we feel good about our lives, we feel good about our future, we are in our lives, fully in our lives and participating and so on. And they have a wonderful little 10-point quiz to assess for you, for yourself, where you are on the spectrum of flourishing, right? Flourishing, by the way, is on the opposite side of the spectrum from languishing,
Right.
which is a word that we're hearing more of as we've struggled to find some kind of language for describing this peculiar state that we are all in, many of us are in, after a year of being cooped up, frightened, uncertain, disconnected from people, disconnected from opportunities to be outdoors, to socialize and so on. This has had a huge impact on all of us.
Well, hopefully we're coming out of that now. I mean, things are starting to open up, literally.
Yes, yes.
So talk about that for a little bit.
Yeah. So, it turns out to be a little more complicated than you might think. I think for many of us, we spent the time in isolation yearning to get back. And then we noticed that started to take on a kind of chronic feeling to it. It wasn't a week, it wasn't a month, it wasn't 2 months or 3 months. It's been going on for more than a year. And when that happens, you see these adaptations taking place, right? In which now it becomes difficult to go back, right? It's not just that you can jump back in. And that's where this idea of languishing comes in. It's like, I'm not really motivated. I am not really looking forward to the future. I'm kind of muddling through. Yeah, I can get out, I can go places now. Maybe I've even been vaccinated, but there's something that's a little bit not quite connecting. And so this is what we're talking about when, and a lot of people are experiencing this.
And our community is so fortunate that for 4 decades now, the Larchmont and the Mamaroneck Community Counseling Center has been around on Stanley Avenue, distinctive looking building that I see from time to time. And you offer a range of services, one in particular to 6th, 7th, and 8th graders at Homix Middle School in the Mamaroneck. But talk a little bit about the services that you offer.
Well, the first thing that we did was we converted all of our services to this format. And much of the psychotherapy world has kind of migrated over to this kind of digital format, the Zoom format. And so we provide counseling and family counseling and crisis intervention to residents of the Larchmont and Mamaroneck communities. And we've continued. We've been fortunate in the sense that the kind of work that we do can work this way. We weren't so sure when we started doing it how this was going to work. It's not the same, and at the same time, it is adequate and it is a useful way of doing this kind of work. And so we've been continuing throughout providing counseling and crisis intervention and support services. We've done a lot of parent support work because parents have been really taking a hit during this period of time, working from home, having their children at home. The stresses involved with that are enormous, and the worry, of course. So we've done that as well.
And I want to make sure that we mention that you've got a special Spanish language program, right? It's called La Casa.
La Casa, yes. And so all of those services that I just described are also available to Spanish-speaking community through our La Casa program. We have staff who are bilingual and can provide those services as well.
And you've got a new program called Our House. Helping people make connections, especially valuable at this time. Well, all of this is described in great detail on your website,
Yes.
which
Yes.
I visited before our interview. So
Yeah.
people need to check that out for sure. And we've got a couple of minutes left. Is there something special you want to tell the community?
I want to just say a few things. It's one thing to talk about, taking the test about flourishing and how are you doing. I think some simple things that you can do to cope during this difficult time are important. And I would, if I could just take a few minutes to list some of these things, they're really simple. I think to take an active approach to managing our own coping is really important. It doesn't happen by itself, right? You have to do something. You have to do something. During this period of time, during this struggle, having a gratitude practice is really, can really do a lot to change the kind of attitude that you have. And it's as simple as taking a moment every day to notice the things that you're grateful for. This can help get you out of those doldrums that you're in and that we're all suffering from to a certain degree. Random acts of kindness. Set yourself a goal during the course of the day to be kind. And to go out of your way to be kind to people, extremely important. It improves the sense of well-being that you have. It improves the sense that you're living in a world that is a good place to be in, and is very important. And then I want to put in a word for kvetching. The power of kvetching is really underestimated. People are apologizing for it. People are feeling they shouldn't do it. They do it too much. You need to kvetch. You need to kvetch. You need to express. And if you don't know what kvetching is, it's complaining, it's whining, it's doing all of these, it's grousing. There are all kinds of words that we have that convey the same thing. When things are not going well, you need to label how you feel about it and you need to get it off your chest because that's what will be better for you. And I feel really strongly that as we've gone through these difficult times, we need outlets and we need to give each other the space to just say, this is really hard. I am really struggling. This is really driving me crazy. And to make room for it,
On your website, you have a photograph of your excellent team. I know some of them on that team.
Yes.
And financially, anything that people can do to volunteer or donate or otherwise support the center?
The counseling center depends on the support of the community and of the state and the local governments and the municipalities. We are a not-for-profit, and so we are certainly always looking for support from the community. If you go to our website, you can see there are ways for you to directly support our work. And those are available on our website, and we're certainly appreciative of that. And we are unique, a unique resource in that we do not turn anyone away for financial reasons. Our emphasis is on access. So if you are a resident of Larchmont, Mamaroneck, and you need our support and you need our help, we're here. And that's an extraordinary thing to be able to say in this day and age. And that's whether you have insurance or you don't have it. We don't even take insurance, actually. We ask people to pay what they can afford. And we're able to do that because of the support that we get from local governments, state governments, and generous people in the community who support our work.
Alan, I'm sure you and I could talk for another half hour about the Community Counseling Center. So I hope you'll come back and tell us more. But thank you for the time you took out of your busy day to tell us what you did about the Community Counseling Center.
Well, thanks for having me, Mike. It's been a pleasure.